So all the same stuff at the beginning, you know, come in, introduce yourself. Hi, my name's Kim. Your doctor's ordered some tube feeds. This is going to be continuous. I'm going to sit you up. The patient always, you always have to raise the head of the bed when you're doing a tube feeding. I'm going to set you up nice and tall. I'm going to check the order and make sure that I have the right tube feed. So this is full strength Jevity. So I'm going to verify that I have the right type, strength, amount, and rate. I'm going to check the expiration date on this. Okay, get some gloves. I'm going to actually, so what's an order? What's my order, Linda?
We want to give full strength Jevity at 60 cc's.
Okay.
30 cc's an hour.
30 cc's an hour. So the rule of thumb is that you put 4 hours worth in the tube. So you said 30, so I'm going to put 120. So I've got this right here that says measuring cup. So I'm going to measure, let's make it 20. The order is for 20 mLs an hour. So I'm going to give 80. Or I'm going to pour 80 in the, so I measured these, has a little marking on it so you can measure it. I'm going to clamp this tubing. I'm going to pour in my tube feed. Going to hang it up. Thank you. And I'm going to go ahead and prime this tubing. Is there a trash can on that side? Give that to me.
We got everything over here.
Thank you. So it primes just the same way as IV tubing does. You kind of, well, maybe not. I thought you could fill that chamber up without turning it on, but I guess not. You just got to start going. So I'm going to put that, there we go. Okay, so got that prime. Don't these normally have a little cap?
Yeah.
Will it during CPEs? Will we give them? We don't know. Okay. It's not sterile, so it's not like the IV tubing cap. But if you had a little, I mean, I'm just gonna lay this right here in the bed, and so it'd be nice if it had a little cap on it. But not. If not, I guess it's okay too. All right, so I've got that all ready. So now I'm ready to assess. So I'm gonna get to his G-tube here. I'm gonna put this towel down just so I don't make a mess. First thing I need to do is verify placement. So I'm going to inject some air. I'm gonna put my stethoscope here on his belly. Anytime I open this, I've got to have the tube pinched, clamped.
And if you don't have it clamped, it will remind you because the feeding will come out. Gonna make a mess.
Whoosh. So I heard the whoosh. Now I have to check residual. I have to make sure that it's safe to give this man a feeding, that it doesn't have a belly full already. So I'm going to aspirate, and I'm not getting anything back. So I'm good. If you got something back, then you would measure it and then always give it back. You always give your residual back. What if I pulled out what if I pulled this thing all the way full and it was full? What should I do? What? I should call the doctor?
Just hold the beating and come back with an hour.
Really? Just 70 mLs I should hold the beating?
70, no.
But how do I know? How do I know if it's more? Because this thing is full. Now what do I do? I'm going to squirt the residual into some cup or something. This gets kind of gross. And I'm going to keep doing it until I don't get any more. All right? And because here's the thing. If there's 200 in there and all I check is 1, how would I ever know it? So I'm going to keep going. But regardless, even if I get 200 mils out, I'm giving all 200 back. Which it's kind of gross. It gets gross. So when do you hold it? All of our stuff says 150. So we use that cutoff, but you would follow whatever the policy of your facility is. But for learning purposes, if the residual is greater than 150, we're going to hold the feeding. Okay? All right, so since I just checked residual and I gave it all back, now I'm going to, before I start the tube feeding, I'm going to flush this. So I'm going to pull up some water. I'm going to flush with the water, which I'm not really actually going to do. And then I'm going to hook up my tube feeding bag. Okay? I'm going to set my pump to 20 mils an hour. And then you don't have to do this in CPEs, but in real life, I like to take a washcloth and kind of put it like this, just in case that connection comes undone. You're not left with a mess. And then, can I get you anything? Here's your call light. I'm going to leave you sitting up because I don't want you to aspirate. I'm going to put the bed back in the low position. And then,
With the head of the bed, with a continuous feeding, it stays up at 30 degrees at all times because it's a continuous feeding. At any point, they can aspirate. Now, if it's an intermittent feeding, at least for 30 minutes before you let them lie back down. But I tend to leave mine up because how would you go put it down, I put it back up to feed it again.
that's it.